calculator versus test kits. I'm Dr. Stan Yates, board-certified OB/GYN physician with over 30 years of experience in women's health. I've cared for thousands of pregnant women in my career. The industry surrounding fertility is valued at $50 billion. A tremendous amount of money is spent in achieving pregnancy through testing, health care, and other resources. Despite all the advanced technology today, many couples are still struggling to conceive simply because they're tracking their fertility incorrectly. The difference between success and frustration often comes down to one thing: understanding how to accurately track fertility. There's a difference between predicting and confirming ovulation. A weather forecast may accurately predict the weather, but sometimes the weatherman isn't correct. The only way you know for certain that if ovulation's occurred is if you're pregnant. Otherwise, confirmation of ovulation is not always easy. The advantages of an ovulation calculator is that they're free and convenient. This concept uses a simple mathematical formula which assumes you'll ovulate 12 to 16 days before your next period. But here's what you need to recognize: this concept can be inaccurate in the following circumstances. If you have irregular menstrual cycles, polycystic ovarian syndrome, perimenopause, high stress levels, or certain medication. Now let's look at the LH test kits, also known as ovulation predictor kit. These tools detect the luteinizing hormone surge that happens 12 to 24 hours before ovulation. They're about 90% accurate in detecting this surge, but they're not free, with a price tag of $12 to $50. For more accuracy and less frustration, I recommend using a combination of the calculator formula to estimate when to start testing with LH kit, basal body temperature tracking, and cervical mucus monitoring. Fertility tracking is more accurate if you use more than one or two methods. Your body sends signals that you can use to your advantage. Basal body temperature tracking can help you identify when your temperature shifts after ovulation. Cervical mucus monitoring can help you discern when the body is producing the best mucus ready for fertility. LH test kits can confirm when you're experiencing a surge. Many patients struggle with different problems. If you have irregular menstrual cycles, it can be challenging to track your ovulation. That's why I recommend using a combination of methods, including basal body temperature tracking and cervical mucus monitoring. If you have polycystic ovarian syndrome, you may experience irregular ovulation or anovulation, which means no ovulation. In these cases, I recommend using LH test kits to confirm when or if you're experiencing a surge. Stress can unpredictably affect your fertility by altering your hormone levels. Consider using stress-reducing techniques such as prayer, meditation, or yoga to help manage your stress levels. Certain medications can affect your fertility by altering your hormone levels. Review your medications with your women's healthcare provider about any potential interactions with your fertility. As you get older, your potential fertility declines. However, age doesn't always mean that you can't get pregnant. I've delivered healthy babies for many women in their 40s who thought that they were in perimenopause or menopause. You should discuss your health and goals with your healthcare provider. The Mediterranean diet is linked to better health, which enhances fertility. It's best to avoid a diet that centers on processed and sugary food. Patients report improvements in their conception odds by eating whole foods rich in antioxidants, getting moderate exercise, managing stress effectively, ensuring adequate sleep. Your body needs specific nutrients to optimize fertility. Here are some key players: vitamin D, folate, zinc, selenium, and omega-3 fatty acid. If you're pursuing pregnancy now, here's what you can do. Start tracking your menstrual cycle using both the calculator formula and LH test. Track your menstrual cycle with the calendar or a reliable tracking app. Begin implementing lifestyle changes we've discussed. If you've been trying for more than 6 months and you're over 35, or for more than a year and you're under 35, it's time to consult a reproductive health professional. Don't wait. Early intervention often leads to better outcomes. Finally, I want to share some common fertility misconceptions. Fertility affects only women. Well, that's not true. Men's fertility declines with age, just like a woman. Both partners should be tracking their fertility and making lifestyle changes to optimize their chances of conception. Fertility tracking is complicated. Well, that's not true. With right tools and knowledge, fertility tracking can be simple, economical, and straightforward. Fertility problems affect older women. Again, not true. Women of any age can experience fertility challenges. If you're concerned about your fertility, it's never too early or too late to talk to a reproductive health professional. Start tracking your fertility status with confidence. Track your menstrual cycle, begin implementing lifestyle changes, and schedule an appointment with a reproductive health care provider if you've been trying to conceive for more than 6 months. Remember, you're not alone in this journey. Our team at Stork Advisor is here to encourage and educate women in their goals to become mom. I'm Dr. Stan. Subscribe to our channel for more evidence-based fertility guidance and join our community of women who are all working towards the same goal. Thanks for watching.